Good afternoon, good afternoon, good afternoon, everyone. We are about 30 seconds away from a formal start, but we'll allow you an opportunity to share. We are on our Facebook page. We're on our YouTube page for the National Baptist Convention Hope Health Ministry. Feel free to share. Thank you all that already shared. Wow, wonderful. We'll do that. We're going to do our best to monitor those locations. We're glad for our guests on today. So go ahead now, tag people, share it. We have the questions. You can also still join us directly here on Zoom. You can go to our Facebook page and click, and you can go directly through it. I got my phone, I got my laptop, everything. So if we ask a question here, we're going to do our best to be able to get it covered. All right. Good afternoon and welcome. My name is Michael Miner, and I am the National Director of the National Baptist Convention USA Incorporated Hope Health Ministry. We're pleased to welcome you today to the second of our three webinars that we're offering during the National Baptist Congress. We bring you greetings today on behalf of our president of our convention, Dr. Jerry Young, our Congress President, Dr. Elliott Cuff, our Congress Dean, Dr. Carl Washington. Of course, we do recognize Dr. Alvin Edwards, our General Secretary, and Dr. Alvin Love, the chair of our federal faith-based initiative. And once again, I'm glad that I am going into my 11th year serving as National Director of our H.O.P.E Health Initiative. All right. Again, we want to remind everyone, we'll say it several times during the session today, that we are still having our class. You can join us each morning at 10 a.m. Central Time. For those of you all that missed it, we come in and we've made recordings so that you can be a part of what we are sharing. Yesterday in our webinar, we gave an overview of HOPE. Oh, wow. Thank you all for the questions and things that we have. Today, we're going to deal with some things from the U.S. Department of Health and Human Services. And of course, tomorrow, we'll close out with an examination of the 1619 Project and critical race theory. All right. For those that are watching on Zoom, Sister Linda Copper, thank you. She's our chat monitor. She is sharing those things there for us. All right. Well, let's get ready to share in today's webinar. I'm going to begin with the introductions of our three panelists, and then we'll jump right on into it. Oh, yes, you're wondering, what are we going to cover? The Affordable Care Act, ACA, Medicare, and the COVID-19 vaccination. All right, so let me begin by introducing Ms. Kim Stopika Dobbs. I got it right, I think. Yeah, I did. Okay. All right, we'll bring it up on the screen here. She's a regional administrator for CMS in Kansas City, Region 7, which is Local Engagement Administration, the Office of Program Operations and Local Engagement. As regional administrator and staff director for CMS, Kansas City, Kim leads and coordinates local external engagement efforts with all regional stakeholders and customers, wow, in Iowa, Kansas, Missouri, and Nebraska. Wow, I don't know how she monitors all the football rivalries. Okay, she also provides administrative and operational support to all employees in the Centers for Medicare and Medicaid Services, Kansas City, promoting cohesion and collaboration throughout the regional office and with other CMS components. Prior to joining CMS, get this now, Kim served as the program manager for the Health Profession Opportunities Grant Program in the Office of Family Assistance Administration for Children and Families. The HPOG program awards competitive discretionary grants to organizations to provide education and training to temporary assistance for needy families, TANF recipients, and other low-income individuals. Welcome, 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 Kim, to our session today. All right.
Thank you. It's wonderful to be here. Thank you all. Thank you for having me.
All right. And now we're going to come in and we're going to introduce Sharon. All right, Sharon Graham. She's also a regional administrator for the Centers for Medicare and Medicaid Services in Philadelphia, Region 3, Local Engagement Administration, Office of Program Operations and Local Engagement, just like Kim. All right. She does all these wonderful things there in Philadelphia. She does all the same things for external engagement and regional stakeholder work. But check this out. She's got Delaware, DC, Maryland, Pennsylvania, Virginia, and West Virginia. Wow. She got her hands and her feet full. Okay. She also provides administrative and operating support to all the employees there in Philadelphia. And she want to make sure they all work together and make it happen. Now, I know she looks just like somebody's daughter, but she has been there CMS for nearly 30 years, engaged primarily in Medicare program operations and outreach. Prior to her current role as regional administrator, she served as the National Deputy Consortium Administrator for the CMS field operations of Medicare Advantage and Part D, where she oversaw the administrative and budgetary aspect of the business line. Ladies and gentlemen, Sharon Graham, thanks for joining us today.
Thank you for that kind introduction.
All right. And we have one more, and this is going to be a quick introduction because he didn't give me much to say about him, but I heard he's on fire. Okay. And we have Thomas Bain, who is a special assistant to the regional administrator for New York. And he wanted me to make sure each one of y'all knows that when he's talking today, he is a licensed social worker. Welcome, Thomas.
Thank you so much, and thank you to everyone that's joining today. Appreciate being with you all.
All right, wonderful, wonderful. All right. Now, let me put my this little point of information, whatever you want to say. I know how you all are at National Baptist. I know how the health ministry workers are going to do. I know how these moderators are going to do, and you pastors. Now, a lot of these things that we share today will not be time sensitive. Some will be. So I got a suggestion for you. What we do in our state convention, we take these videos you see right here, and we show snippets, those little parts of it. So when your association meetings that come up for the fall, those training sessions that you have, do that for those things that may be dated by the time that you have it. And guess what? They have said, the group, that they are willing to be with us again in September so we can do it all over again. And of course, if you got any additional questions that arise, you can email us at info@hopenbc.com, info@hopenbc.com, and we can get that rolling for you. All right, look, I hope you all are ready. Get your notepads out, get you ready to do. We're gonna start this COVID-19 vaccine. We're gonna bring up Kim and Thomas here to share with us. We're excited, so let me bring up Kim first, ladies first. Here we go. We add Kim in here, and then we're adding Thomas. Now, we know for those of you all watching on Facebook, you'll only see the picture of the person talking, but that's okay. One of the things, everybody, why we wanted them to come and talk about the COVID-19 vaccine is because there's been all kind of crazy stuff out there taught. So we want to be able to walk through directly from, as they say, the horse's mouth, okay? All right, so let's begin with this, Kim and Thomas. Question number one. All right, and there have been some things floating around that if I got to get the COVID vaccination, I got to come out of my pocket. I'm going to lay it right now. Is the COVID-19 vaccine free?
Thank you. Yes. So very clearly, the COVID-19 vaccine is free. So, and I want to be clear too, that the COVID-19 vaccine and the administration, sometimes they'll talk about two charges, but the vaccine and the administration is free for any individual living in the United States, regardless of their insurance or immigration status. And those are two big caveats that sometimes get missed. So again, vaccine and the administration is free for any individual living in the United States, regardless of their insurance or immigration status. So currently, all providers who are administering the COVID-19 vaccine, so in any setting, are required to actually sign an agreement with the Centers for Disease Control and Prevention, or the CDC. They sign a provider agreement. Among those requirements in that agreement is that providers must administer the COVID-19 vaccine at no out-of-pocket cost to the patients. And so in addition to that, in order to ensure what they call no surprise billing, right? So basically that means you get home and you magically get a bill and you're like, what was this for? So that's surprise billing. So in order to ensure that doesn't happen, providers may not require that patients have additional medical services in order to receive the COVID-19 vaccine. So you can't go into a provider and say, I need to get a COVID vaccine. And they say, great, let me give you a physical first. No, they just need to give you, it's just the vaccine. So they can't charge you for that. Nor can they charge you for a fee if the COVID vaccine is the sole medical service being provided. So those are the two pieces there. So providers cannot bill patients, but providers can seek reimbursement for vaccine administration through Medicare, Medicaid, private insurance, or other applicable coverage that somebody would have. So this is why when you go in, even with the vaccine being free to you as the patient, this is why a provider may still ask you for your insurance administration. It is not so that they can charge you, it is so that they can charge the appropriate insurance. And so for Medicare, that's why individuals are required to bring that original red, white, and blue Medicare card.
Kim, I'm glad you said that. We did a drive-through at our church, and I didn't know that at the time. It was a couple of months ago, and they had to ask for that because we did have a couple of people to come up and say, "Wait a minute, if it's free, why are you asking for this insurance information?" So again, for everyone, what Kim has shared, right, they're not out here trying to do anything flim-flam. They can get the reimbursement for that when it goes through. And the other thing, folks, look. They call in, you get it all done. Say, hey, wait a minute. Now we need to check your ears and make sure they're all right. And then we get a fee for that. So make sure you got that. You take your notes and seeing how those things are done. All right, Kim, let's go to the next one here. All right, now, what if I've already paid my provider to get the vaccination? What am I to do then? Am I just out of luck?
Great question. So, in the beginning, I think there was a little bit of confusion, and in trying to think the best and give people the benefit of the doubt, I think there was confusion about should or shouldn't people be charged for it, and so. What we have been telling people, both just generally, is when you get the COVID vaccine, your provider can't charge you for an office visit or other fee if the vaccine is the only medical service you got. If you got other medical services at the same time, right? So this would be, again, not that they required it, but that if by chance you received other medical services at the same time, you may still owe a copay or a deductible for those services. However, providers that charged impermissible fees must refund the patient and ensure that individuals are not charged fees for the COVID-19 vaccine or vaccine administration in the future. So individuals are encouraged to follow up with their provider first to request clarification about any charges and request a refund as needed. If the provider refuses or individuals are aware of potential fraud or abuse, they're encouraged to submit their tips or complaints to tips.hhs.gov or call the OIG hotline at 1-800-HHS-TIPS. And so, or if you are a Medicare beneficiary, you can also call 1-800-MEDICARE. And that is another option if you are receiving Medicare.
Okay. I'm glad you brought that up. We have a lot of crazy things happening the first of the year. And so again, for our churches, for our pastors, for our moderators, our state convention presidents, you might want to share some of your conversations with those people who took it early. If that was the case and then they were charged for it, we can follow through and get that done. Thank you so much, Kim, for that. All right, let's go to the next part of it. I know it sounds like a crazy question, but hey, where can a person get the vaccine?
Yes. So as you probably heard, now that in the beginning it was a little different and now it's hopefully lots of places. So there's three main ways that we're encouraging people to find a vaccine location near them. And it's really what works best for you, right? What's most convenient, both for getting the information and getting there. So people can go to vaccines.gov. So if the web is the easiest thing, you can do that. You can actually text your zip code to get vax or 438829 to get a text back with places that you can get the shot that are close by. So if texting is your thing, that's quick too. And then the other way too is that if you have friends or family members who are not comfortable on text or web, there's a 1-800 line. So if I've got a landline or I've got, whatever technology, there's the National COVID Vaccine Assistance Hotline. That's 1-800-232-0233. And that you can connect there to find a vaccine near you. The last piece that I will just put in to mention is that actually through the U.S. Health and Human Services, and particularly the Administration for Community Living, which they established the disability just recently. They established the Disability Information and Access Line, which is now available specifically to help people who have disabilities find vaccination locations in their community, and then assist those callers with vaccine appointments or connect callers to local services. So you can visit the website at acl.gov/dial or call 1-888-677-1199. That is particularly helpful as we know that, in our communities who, who are living with disabilities and making sure that they can get connected to the things that they need during the pandemic and to vaccines.
All right. Thank you so much for that, Kim. Look, just a reminder to everyone, my name is Michael Mapp, the National Baptist Convention, USA Incorporated Hope Health Ministry. We are in our webinar as part of the National Baptist Congress. Today, we have guests from the U.S. Department of Health and Human Services. We're talking about the Affordable Care Act, Medicare, and the COVID-19 vaccination. Thank you again for joining us on Zoom, Facebook, and YouTube. All right, so Kim, that was important because we have had some questions about people with disabilities. So I got a couple people that I'm going to directly, when I get off this, I'm going to text them. I'm going to email the other one and let them know. All right, so people, that was a special thing, just got started. It wasn't there before for people with disabilities. All right. Okay, now I have a wonderful uncle, but he is bedridden. And he just, got a lot of issues. He hardly ever goes out of the house, just problematic. So can a person get a vaccination at home?
Thank you. Yes. So the short answer here is yes. So if you have Medicare and have a disability or face other challenges in getting to a location away from your home for a vaccination, Medicare will pay a doctor or other care provider to give you the COVID-19 vaccine in your home. You may need to give them your Medicare number for billing, but there's still no cost for you for the vaccine and its administration. So you'd contact your regular doctor or healthcare provider and ask if they're able to give you the COVID vaccine in your home. If they can't, they might be able to refer you to someone who can do this. You can also call 1-800-MEDICARE for vaccine contacts in your state. And more details on providers of the COVID-19 vaccine are also still available, as we mentioned earlier, on vaccines.gov. And then this is always a nice reminder when we're talking about Medicare and trying to contact people, and that is just a reminder to please don't give out your Medicare number or accept a vaccine from anyone who isn't a known or trusted provider or who contacts you without your invitation. So we always that's a good reminder to just keep that information protected.
All right. Again, I know I had some pastors and others who asked about that. They have people that are on their prayer list that are bedridden, they're homebound. You just heard it right here. They can get taken care of, they can get that done, and we can move on. The biggest issue we've had early on, we had stories where people had gotten the COVID-19 from their provider, their home health aide and whatnot and everything. So everybody, you just heard it from Kim, get the information, let's share that so that we can take care of that. All right, we're moving on. Now, look, are there resources to make it easier to people get vaccinated? The big issue is about transportation. Sometimes people have the time and whatnot. What's out there to help the people make it better to get the vaccination?
Sure. So a few key points here. So one is just accessibility and timing. So thousands of pharmacies nationwide will stay open late every Friday in June. So we're approaching the end of that, but and offer services throughout the night to make sure that everyone can get their shot. So if you still have people who are interested, we're coming up on a Friday soon, yay. So participating pharmacy chains include Albertsons, CVS, Rite Aid, and Walgreens. So just check those local hours to see if we know, right, there's work hours. And so this is a time outside of work hours to hopefully catch people. Then for transportation, some may be aware, but this a fantastic option. Uber and Lyft are both offering free rides to and from vaccination sites. So Lyft is offering $15 each way to and from the vaccination appointment. Uber is offering up to 4 free rides, so up to $25 off each way through July 4th. So just to be clear, and if you go to the website, which if we go to those websites, they each have their own websites for more information, and they explained exactly how they work and up to what amounts. Finally, I just want to mention that the National Aging and Disability Transportation Center provides a list of programs providing transportation or connecting older adults and people with disabilities to vaccination sites as well. And then the last piece around childcare. So you may have seen that 4 of the nation's largest childcare providers will offer free childcare to all parents and caregivers getting vaccinated or recovering from vaccination from now until July 4th. So KinderCare and Learning Care Group locations across the country will offer free drop-in appointments to any parent or caregiver who needs support to get vaccinated or recover from vaccination. And then more than 500 YMCAs in nearly every state will offer drop-in care during vaccination appointments. And then Bright Horizons will also provide free childcare to support the vaccination of 10 million workers employed at participating organizations. So all 3 of these things that I spoke about are actually, there's more details on the vaccines.gov/incentives. And there's lots more information there about how to access those.
Okay. All right. And we're already seeing this. Look, everyone, we will work to get a transcript with these URLs and websites. We'll work with you to get that done and email it to you. I'm already seeing it, and we're working on it. And thank you all for your interest thus far. All right. Well, this is the big question for us all. What can we do as collectively, individually, to get the information out into our communities, to get as a President Biden says, vaccination in arms?
Yeah. So there's a number of resources out there. I think one of the biggest things that we've heard from our stakeholders and communities is making sure that there is factual information available when people are ready to receive it, right? Okay. So that's one of the big pieces to make sure that we have, that people have ready. And some of the ways that we can do that. So, there's websites, there's the community core, which you may be familiar with. So you can join the community core and get tips and tools. Yay! Resources. Yes. The We Can Do This campaign. So that's part of the We Can Do This campaign. And so through the We Can Do This campaign, there are a number of resources and toolkits that are found on the wecandothis.hhs.gov/resources. Those toolkits provide full packages of materials with ideas of how to use them. There's ready-made materials for social media. There's videos, there's posters and flyers that you can print. Both the toolkits and materials were created for particular audiences. So there's even a faith-based leaders toolkit and guide in case you would like to peruse that one. So there's that. And then another resource that you may be familiar with too, that I've found particularly helpful too, is the National COVID-19 Resiliency Network led by Morehouse School of Medicine. They offer individuals, families, and community organizations access to new COVID-19 related resources to help reduce the negative impact of the pandemic on communities. And so the NCRN is what it's called, was created for community by community to ensure the diverse needs of our nation are understood and addressed. And so they offer webinars and lots of different great resources. And then the last thing I would just say is one of the most impactful things that we have, that I think that we've heard, and that I would venture many of the people on the webinar have heard too, is share your own story. Share your own story on social media and conversations you've had with friends and family. I saw Michael's awesome vaccine picture when we were talking earlier. And so I just encourage people to do that and just to talk about it. And then, and like I said, the kind of the myths and the facts piece, I think at the beginning, the link was shared to the CDC myths and facts page. That is a great one to have handy because they're trying to keep up with the different myths that are floating around out there from the CDC. And so they're trying to put information on the website so that people can have the factual information to answer some of those myths.
All right. Wow. Now, look, we've covered a lot of information. Look, is there anything, Kim and Thomas, that we missed about this COVID-19 vaccination before we move on? Anything we missed?
I just want to say thank you to all of you that are doing good work in this area and sharing information with communities across the country. You are the trusted messengers. You just learned from Kim where to get the most up-to-date information and answer people's questions. So thank you, Dr. Miner, for the opportunity, and great presentation, Kim.
Okay. All right. Look, let me just close with this before we go on and talk about the marketplace. Thank you, Kim. Thank you, Thomas. Again, I was reading the USA Today today that our COVID deaths are down, way down, but those that are dying are younger and disproportionately Black. I read a story of a group of three people working in a lab. One of them was vaccinated, the other two weren't, young people. And one of them got the COVID-19, sick, went to the doctor, a few days later, died. The other person, the officer who got it from him, a few days after that, died. But the person who had the vaccination, they put them on to put them on the line of the sides and make sure things are all right. There was not a problem at all. And that really struck me because there were two young people in a lab, probably future doctors, scientists, or whatever else that are gone. And all they had to do was get shots in the arm. 3 people exposed to the vaccine, 2 dead, 1 still living. Folks, get your shot. All right. Let me get out the preacher thing here. Thanks again, Kim. You'll be coming back here in a minute. Thanks again, Thomas. Remember, he told you he is a licensed social worker. We want to make sure we get that part in there. All right. Now, we're going to talk about the marketplace. We're going to bring in Sharon. Okay. We're going to add to the spotlight. Okay. Let me get this in because it's about to half. I know we got some questions. You all just put your questions there we're going to get through all this. We promise. Get them in the chat. We're going to get you, Sister Scott. We're going to get you there. Look, for those who just joined us, my name is Michael Miner. I'm the chair of the National Baptist Convention USA Incorporated Hope Health Ministry. We are having the second of our 3 webinars during the National Baptist Congress. Today, we have guests from the U.S. Department of Health and Human Services. We're talking about the Affordable Care Act, Medicare, and the COVID-19 vaccination. We are restreaming today on Facebook and YouTube. Feel free to share. Thank you again, once again, for joining. All right, now we're going to talk about the marketplace, special enrollment period. Now, look, I know I don't want to get Sharon started, but for some of y'all out here, y'all know what it is. We call it what? Obamacare. All right. Okay, I just got that out there and laid it out. It's all the same thing. Walk like a duck, quack like a duck. It is a duck. Okay. All right. So, let's just lay it right out. Sharon, some people were confused. They said, wow, the open enrollment was over and it comes out. Then they get confused again because it's supposed to be over May 15th. Then it was over August 15th. When it first got started, it said it was a COVID-19 special enrollment period. And people were saying, well, unless you've had COVID-19 and somebody in your family had COVID-19, you can't sign up for this thing. So will you please tell us something about what this special enrollment period is, Sharon?
Sure thing. Yeah, happy to clear up any confusion because this is really an exciting opportunity for people to enroll in health insurance who don't otherwise have health insurance. President Biden, back on January 28th, and due to the public health emergency, signed an executive order extending the special enrollment period, as you mentioned, originally May, now back to August 15th. So that allows any individual to go out to the marketplace and sign up for healthcare insurance now through August 15th.
All right. So y'all heard that. You don't have to have COVID-19, knows about the COVID-19. You can just, if you go in and take advantage of that. All right. Now, what's the difference between this special enrollment period and the normal one we have that runs from November 1st to December 15th?
Well, really, not a lot is different except the dates. So we've, as you mentioned, the normal enrollment period for the marketplace runs from November 1st through December 15th of every single year. And then the only time you can ever make a change is if you have a certain life change that happens that requires you to perhaps select a different health insurance that maybe, for example, might be eligible to you because you've moved, for example. But now the entire marketplace across the country is open for every individual. Anybody can go to healthcare.gov, for example, or perhaps their state operated website, sign up for healthcare insurance now, and then still have 30 days to finally hit that submit button on their application. So again, the key date is to go online, and of course you can always call a navigator as well too, Dr. Miner, as you know, being a navigator yourself, to help sign up for healthcare coverage, again, through August 15th.
All right. Yes, you got look for full disclosure. In addition to everything else I do direct a Navigate organization, in the state of Mississippi, for those that are there in the state. What we do want you all to know is open to any and everybody, is what you just said. Whether you are state or federal run, you need to check it out by August 15th. Now, the thing about it is, all right, folks hearing about it, we got some folks excited. Now they want to know, where can they go to sign up? Give us some information so we can go, the people that's listening and listen later on can go and get hooked up with some insurance.
Sure. As I mentioned, there are some states that operate their own marketplace. There's about 14 of them. And then the other 36 operate on our federal platform. And that website is healthcare.gov. Now, anybody, regardless of their state, can go to healthcare.gov to get the information that they need. So if you live in a state that's operating its own marketplace, healthcare.gov will still point you to that state website and also provide you all the telephone numbers as well that can be helpful to help you identify either not only the website where you can enroll, but also a local navigator who might help, or even a state 1-800 number if that's needed in your particular state to sign up. So the key thing to remember is healthcare.gov will get you where you need to go.
All right. And remember, folks, this healthcare.gov, G-O-V. Healthcare. Anything else is not the same. That's healthcare.gov, G-O-V. Now, this is one case where if you go to a website and it looks like a duck, walks like a duck, is this case, it might not be a duck. We need to duck it. All right, so healthcare.gov, okay? And the signs that say get Obamacare, that doesn't necessarily mean it's with healthcare.gov. I just want to make sure we're clear on that. All right, moving on. Let me not harp on that. Okay, now this is the thing that people talk about all the time, Sharon. They mock when they talk about the Affordable Care Act. You've question, is the health insurance really affordable now?
It is, Dr. Miner, actually, and thanks to the American Rescue Plan, we've increased the financial assistance that's available to people, which typically will significantly lower their premiums. So you might be familiar with the term tax credits. We sometimes will call it financial aid. It used to be that it was capped to only people who were below 400% of the federal poverty level. But now anybody, regardless of their income, can go to sign up for healthcare coverage and have their out-of-pocket expenses capped at 8% of the premium, which is really just a phenomenal savings. Again, this financial assistance is available not only to people that were less than 400% of the poverty level, but the financial assistance is available to everybody. So we're estimating that, for example, we think that about 4 out of 5 people who are currently enrolled can actually go back to healthcare.gov now and find a plan for $10 or less a month with this new expanded financial assistance. So for a typical family of 4, for example, they might see their premium go down about from, say, $400 a month, for example, down to as little as $163 a month. So that's for an average family of 4. And of course, that could vary depending on the family size, but we're estimating it's about $50 a person where a person could see their healthcare premiums themselves decrease per plan. And so it's always important to go out and check the plans that are available to you. And you might see some shifting there, but people will be able to save money at healthcare.gov.
All right. Look, Sharon, when I was told some of our navigators that was coming on, and we do a lot in the Vietnamese community on the Mississippi Gulf Coast, they wanted me to make sure that I shared the story that there are many of those fishermen who have seen their premiums go to zero because of it. And they want to send, I'm relaying it. They want to send thanks to the administration because those extra dollars are helpful. A lot of them on kind of tight and how things going. And they're really beautiful. I'm gonna get this little clip out, this part, and we have our next session. I'm gonna make sure and show them I told them. So I said it. So, All right, now move on to the next question. Okay. All right. If I'm already enrolled in the marketplace, how do I receive the additional tax credits, lower premium? How can I take advantage of this great benefit?
Yeah, that's really an important question. I'm so glad you asked it because you do have to take action. So current enrollees who going back to the last open enrollment period or potentially at any point since then do need to update their application. So you need to go to the website where you enrolled. And again, for 36 of our states, that's healthcare.gov, to update your application to take advantage of those tax credits. You would just go in and reselect your current plan, and then the tax credits will be applied. Now, there are, of course, the open enrollment here, the special enrollment period is open to new enrollees too. So those tax credits will be applied as soon as they enroll. Now, for the current enrollees also, you don't have to actually reselect your current plan. You could go in now and select an entirely new plan to apply those tax credits. So this is also offering you an opportunity to even switch plans. But we always caution you about that because many of the health plans do have deductibles. It's important for you to understand your plan to see if there's a deductible, because it's most likely that any deductible amounts that you've already paid out of pocket to satisfy the first plan will go away if you change your plans, and then you'll have to satisfy a brand new deductible. So the amount of out-of-pocket costs will most likely not convert from plan to plan. So do be sure to check that if you feel like it's important that you switch plans. Just be aware of that and perhaps even call the plan to ask the question about having to resatisfy a new deductible. So just want to caution our watchers and our listeners today about that particular scenario should they choose to change plans.
Well, Sharon, one thing you can add to your anecdotes, we had a person in the Golden Triangle, Mississippi, that you were just talking about, but even with the resetting the deductible, the drop in their premiums, they still saved money. They did exactly right. They did exactly what you said. They walked through the whole thing, and when you put it all together, it was still, and it wasn't just a small amount, it was a significant amount, even with the reset. So you can add that story to your repertoire. Okay. All right. Now we heard a whole lot about the people who've been unemployed, and there was going to be some benefit out there for them with the ACA and some of this increase in savings. So what's the plan for those people who are unemployed this year?
Yeah, and this is really timely because this particular change takes effect on July 1. So I'm glad we're able to have this conversation now. So this expansion for people who is actually for people who received or who were approved to receive unemployment compensation for any week in the year 2021. And what they need to do is go in and make sure that they, again, update their application. So if you have a person who's been either approved or is receiving unemployment compensation, that actually applies to the entire household for their tax credits and their cost sharing reduction, which is really neat. And so that, again, is regardless of the actual household income too. So there used to be some caps on that as well, but this is, again, regardless of their household income. If you have a tax dependent, though, because of course you have tax filers and tax dependents, the tax dependents won't be able to take advantage of the increased tax credits, but they may still get reductions in their out-of-pocket cost sharing reductions. And then, as you might be aware, there are certain states who chose not to expand Medicaid, but this will still benefit, this particular expansion of the unemployment tax credits will still benefit people in those states who might fall into what we call the Medicaid coverage gap. They'll still be able to receive the enhanced tax credits and the cost saving reductions. So as I mentioned at the top, this will start on July 1. So we're right now in the process of updating our website, healthcare.gov, to account for these changes. And so it's only after July 1 that people can go in to update their applications to take advantage of this particular enhancement. But again, healthcare.gov, July 1, go back in there and update your application.
All right, y'all heard that. Pastors, state convention president, others, you guys are folks that's been unemployed. Don't even talk about trying to explain it. After July 1st, let them go to healthcare.gov and look, the worst thing that can happen is nothing happens, but the best thing that can happen is that they can get some reductions in their premium. Go check it out starting on July 1st. All right, you heard it right here. Sharon said it, okay? All right, thank you. All right, look, Sharon, is there anything? Look, I'm gonna forget this. How can consumers find help? Now, I know we're a religious organization, and the preacher said we find help in the Lord. That's good in general. But for the ACA, all right, for the ACA, how can you find help? No matter where they're in the country, how can they find some help about the ACA?
That's right. And I have been mentioning throughout our conversation here that healthcare.gov is our website where you can go for anything. But of course, we also have a phone number.
Okay.
And hopefully we can provide this also in chat. That phone number is 1-800-318-2596. That's available 24 hours a day, 7 days a week, and actually provides assistance in 150 languages.
Wow.
So I think we can reach just about everybody in the Baptist congregations here with 150 languages available to them. So encourage everybody, again, if it's Marketplace Call Center, 150 languages, our 1-800 number, healthcare.gov. And of course, at healthcare.gov, you can also find the local navigators in your community that you can meet with, who can speak with you specifically about your particular needs there as well.
And for those of you in National Baptist, you know, we do post daily on the ACA. So in case you forget all that stuff, you can go to our Facebook page. It's a daily post. We have the number there and the website. There's no excuse, none, no excuse for you not to know where to go and get information about the ACA. Now, is there anything else? We're going to talk about Medicare just next. But Sharon, is there anything else about the ACA we just say before we start talking about Medicare?
Just go check it out. Really, anybody, if it's not you who needs health insurance, I'm sure that you know someone who needs health insurance. So again, as trusted community resources that you are, whether it be in your church or your community, please go to healthcare.gov, direct your friends and family to healthcare.gov, because this is the time to get health insurance at an extremely reasonable cost.
All right, once again, my name is Michael Miner. I'm the National Director of the National Baptist Convention USA Incorporated Hope Health Ministry. Today, we're in the second of our third in our series of webinars during the National Baptist Congress. Today, we have special guests from the U.S. Department of Health and Human Services. We're talking about the COVID-19 vaccination, the Affordable Care Act, and Medicare. We are restreaming on Facebook and YouTube. We hope that you will share that information. All right, now Sharon, I think I'm supposed to join everybody in on this part. They said in case you fall out or something that I need to add the spotlight, bring everybody up here. All right, there we go. I thought Tom, he didn't run off somewhere. There we go, Tom. Here we go. All right, we're gonna talk about some Medicare. All right, and Medicare uses the hottest subject at our national meetings because our median age is up probably around about 60. And when you get thinking about that, you are thinking about the Medicare. All right, Medicare open enrollment. Okay, all right, here we go. Sharon, what is the Medicare open enrollment period? And why well, it's not going to be me, but my mom. Why does my mom, she got to remember why my mom need to review her plan?
Sure, I'll kick things off, and if Kim or Thomas want to join in, please do. So Medicare, it's important to know that Medicare is for people mostly who are over age 65, health insurance for people over age 65, for certain people with disabilities. That would be people whose Social Security has determined to be on disability. And then for people of any age who have end-stage renal disease, and that would be kidney failure. And so the open enrollment period, kind of like the Marketplace open enrollment period, it comes once a year. And it is the time where we really encourage people to review their healthcare insurance and to make any changes. Now, the open enrollment period won't be starting until October, but it's always good to have that information available to you so that you're ready and prepared and really considering healthcare, because it's something that is really top of mind for us all the time.
All right. Well, now, open enrollment period comes. What do people with Medicare need to do other than complain about the 1,400 million calls they get? What should people be able to do?
Well, so during open enrollment, that's where we really encourage people. What I still like to refer to is look at the 3 C's of cost, coverage, and convenience.
I like that.
It's really easy to remember, the 3 C's, cost, coverage, and convenience. So in the cost category, is your current healthcare option affordable to you? You know, how is the premium? How are the deductibles? What about your out-of-pocket costs? They may be going up from your current plan to the New Year's plan. So make sure you're looking at those out-of-pocket costs that you have to pay. In terms of coverage, are you still getting the healthcare coverage that you need? For example, original Medicare doesn't cover eyeglasses or hearing aids, but Medicare Advantage plans do. And maybe you're in the market for hearing aids. So maybe you need some coverage there, or perhaps your hospital is not in network if you're in a Medicare Advantage plan, or some specialists that you see. Your pharmacy, if you have prescription drug benefits, you want to make sure that you're getting the coverage there for the drugs that you're currently taking. And then also convenience, are the providers available to you? Are they accepting new patients if you're brand new? If you had to go to the hospital, can you go to your community hospital? Or if that's not in network, do you have to go to the next town over? And do you want to do that? So those are the things that really, in my mind, the top 3 things that you should consider as open enrollment is approaching.
I'm gonna throw one thing, Sharon, which Sharon said, you all, for those who's listening, I had a family member of mine that checked everything out that you said, Sharon, except the prescriptions. Because she wanted to get those glasses and everything. She was so excited, get everything lined up. I got me a plan, I'm saving money. And then when it came around, the plan changed. The main medication she needed went from like $10 a month to $300 a month.
Yeah, that's
wow.
A big change.
Right. And remember, Sharon said, she said about the prescriptions, listen to what she said, everybody, check everything out. Now, you might save on these glasses and get them for free, but the other part is going to be an issue. So I'm telling you, from my family who suffered for a whole year, check it out. Did I tell you? Check it out. Okay, there we go.
If I can put a plug in to follow up on what you said, our website, Medicare.gov, allows you to compare plans and to actually put your prescription drugs into a comparison so you can see side by side the out-of-pocket costs for each of your prescriptions to decide. And then you'll be able to see that and hopefully steer away from those plans that are like that.
Well, needless to say, she did not do that.
Good.
Okay, moving on. All right. Now, what are the important dates for us to remember when it comes to Medicare open enrollment?
Well, you want to start preparing. It's never too early to prepare, but we really consider September to be your preparation time. Review your current situation. Yep, September. We're getting another couple months. But September is also when you receive your Medicare and new handbook. Every household that has at least one Medicare eligible person will receive one Medicare and new handbook, and that's a great resource for all things Medicare, and also the plans that are available to you, the Medicare Advantage plans available to you are in the back of that in the appendix. Then open enrollment starts on October 15th. So that's when you can go online to our website, medicare.gov, or even call 1-800-MEDICARE, or perhaps get in touch with some local resources that you might have to review your options and to sign up for coverage that would begin on January 1st of the next year. The window for open enrollment is October 15th through December 7th. So at least people do have that approximately 7-week window or so to review their options and to make the change. And then, of course, on January 1 of the new calendar year is when your new healthcare coverage would take effect.
And also remember, everybody, when we'll get the updates on our annual session in September. I don't know if it'll be Sharon, but we have some folks here from HHS that will come and talk about this more again. But remember what she said, September should be a month of preparation. Like you get ready for us as these are us good Baptist folks in here. You do go through Lent and Advent and making preparation and stuff. So she just said you got your Advent season also in September, the Advent for the start of open enrollment for Medicare. So September, get with mom them, grandma them, all them, and start going. And don't forget that thing about that prescription drug too when you're going at it. All right. Okay. Now, people do all this to get things lined up, and then grandmama says she's gonna take care of it. Granddad come back and check with her on December the 8th, and lo and behold, grandma missed the deadline. What can you do if you miss the deadline?
Well, for most people, they will have to wait until the next year's open enrollment period. We have a few exceptions where perhaps if you move or have another exceptional circumstance, you could change coverage, but for the most part, December 7th, at any point after that, you will have to wait an entire calendar year before you're able to make another change. One of the other exceptions are for the people who enroll in Medicare Advantage plans. They have a window of January 1 through March 31st where they can make a change. But again, that's only for people in Medicare Advantage plans, which is probably about 40% of our population. It's a good chunk. But for most people, you really need to consider by December 7th as a hard and fast date to live by.
All right, there we go. All right, now, where can I, Sharon, where can I go get more information about Medicare open enrollment?
Mhm. Well, as I mentioned before, our website, medicare.gov, is phenomenal. It really has such a great wealth of information, even just beyond Medicare open enrollment. There's so much out there. I'd encourage all of your viewers to go there and check it out. Within medicare.gov, we have a plan compare website, and the button's right there on the main page. And that's where you can go in, as I mentioned earlier, and compare not only original Medicare, but compare original Medicare to your Medicare Advantage plans and even those prescription drug plans. I also mentioned the Medicare New Handbook, a phenomenal resource that everybody will receive in the mail around the last week of September. That's a great resource. Our 1-800-Medicare line is available for people 24 hours a day, 7 days a week. And we have people available again in, I don't know if it's 150 languages, but it's an awful lot of languages that can help you walk through the Medicare enrollment process. And then we also have our local, they're sort of like the navigators have in the marketplace program. We have something called the State Health Insurance and Assistance Program. And those are local counselors in your community who can help.
Right. We call them the SHIP.
A SHIP, exactly, the SHIPs. And they have a shipcenter.org website that can direct you. There's usually state specific, they are state specific, and you can direct yourself to your local state resource in the SHIPs.
All right, I apologize for turning back around. We're getting some questions from social media and other places that we want to bring in. I think that covers everything that I wanted to ask. Sharon, Kim, Thomas, is there anything else that I missed that you, before we go into our Q&A, that you will share at this time?
I just wanted to say one thing. I thought that was a great overview by Sharon, but a lot of times people ask, what's the best Medicare plan or what's the best marketplace plan? And it's really so specific to the individual. As Sharon mentioned, you have to look at your own needs. And as Dr. Miner said, if you're using prescription medications, really compare those, especially on the Medicare side, because it can make a big difference year from year if you change your medication. So the best plan for your neighbor could be different than the best plan for you. And if you are satisfied with your plan, you don't have to change. That's another thing to consider. But we want you to make an informed decision, not just a default decision. So stay educated and make the right choice for yourself. Thanks, Dr. Miner.
All right. And look, National Baptist, we'll be doing some promotion before when September rolls around, that we'll have this webinar again so that you can prepare for October. Look, we know we're getting to the top of the hour. We know that usually we do our Q&A and the question and answer, the interview part within an hour. We're going to run a little bit over to do the Q&A part, but we're getting ready to do that. So Sister Linda Copper is going to assist me in this. Let me go with the first question that we have. Now, we know some questions that we're not going to be able to answer, but we'll do the best. So the first question that we have here is for Medicare Advantage. Can you change your address at any time?
Yeah, of course, if you move, you really should actually update your address, because especially with original Medicare is available across the country, but Medicare Advantage plans are very specific to geographic areas. And it could be that, let's say if I go from Pennsylvania to Florida in the wintertime, my plan in Pennsylvania won't be available in Florida. So it's important that I update my address, and that will allow me then to change to a different plan that I can access in Florida.
Okay. All right. For the Affordable Care Act, I mean, I already know this answer, but I'm going to share because we asked it. With a lot of things going on with the COVID-19 about mental health, does the Affordable Care Act coverage cover mental health services?
Yes, that is one of the key benefits that every plan in the Affordable Care Act on the marketplace, as we would say, would have to cover.
I'm thinking that whether the person that asked this question may have gotten a plan that was maybe, I don't know, that was said or whatever, and it didn't cover it, and they associating that with it. So get this clear, whoever asking that question, that if you had a plan that didn't cover mental health, then it was not an ACA plan. It's no type of plan. Let's just pause and remember, everybody, there are all kinds of health plans out there. And they may even tell you that it is Obamacare or it's like this, whatever case it may be. But one thing to remember, there are certain benefits associated with the ACA, preventive service and whatnot. Check it out, look at it. If you don't know for sure, guess where you can go? Healthcare.gov, and check it out and find that information about it. Okay. And also, for those that are watching here with us on Zoom, feel free to just raise your hand. We'll unmute you and ask your question. Sister Linda, do we have any questions from any other places here?
Not at this time.
Okay. All right. I have another question here from the social media, and I guess this is where we always are. I guess it must be some mom or whatnot. They're concerned because their grandchild just will not take the vaccination. They want to know what. But I'm asking now, what do you suggest that she do? Is that Kim? Okay.
Oh yeah, yeah. Oh, I wish there was a magic answer to right to do the. I mean, so in conversations and in different things, interestingly, I this is definitely not like here's the government answer. This is just from experience of having some conversations and getting some technical assistance as well. I think it is just a conversation of hearing what the concerns are, right? Like hearing, okay, well, what are your what are the concerns? And really just having that open conversation. And then, the making sure that whoever it is has the factual information to make a decision, and then ultimately that decision is that person's, right? No one is trying to force, no one is saying you have to because of X. It is that everybody is informed with the information, and then that they can then make an informed decision with that information. We always direct people like to the CDC has fantastic fact-based information that is, actually relatively, so does the We Can Do This campaign, but it is easy to digest. It is not the super, like you don't be a doctor. I can understand it. If I can understand it, I'm sure anybody can understand it. So that has been really helpful with that. And then interestingly, I think even this, I believe it was the CDC, I remember reading it a while back now, there's a page on CDC, and it's like a toolkit for talking to friends and family about the COVID-19 vaccine. And it kind of walks you through, right, how to have that conversation. And that was helpful just to like get ideas from. So.
All right.
And Dr. Minor, there is a chat comment with the toolkit. How long does it take to receive the toolkit? The We Can Do campaign toolkit.
Oh, sure. Yeah. So they are all electronic. So you literally just download them from the We Can Do This campaign and website, and then you can use the pieces of it however you see fit. So if you want to use like the social media pieces or the video pieces, you just use those into your feed or however, and then the other posters and those kinds of things, it's all set to just download. So it's automatic. And then there are also you'll notice on there, if you go to the We Can Do This, if you go to the We Can Do This campaign site, they actually also have like a contact page, and you can ask questions about how to use it and what you need. And we meet with them regularly, and we try to inform them too of, hey, we've heard from the field, people need more of this resource, or people need more of this format of materials, or, so they are very open to suggestions too. So I would just say definitely use the resources there. They're immediately available. And then also feel free to actually use the contact us button and contact them.
All right. And the Mel said, Sister Curtis, make sure to remind me, we'll be updating our website over the next couple of days so that we can make sure we have those links so you can go directly there. I know a lot of you all get lost and just trying to find places. What we'll probably do is carve out, if we have to, an extra page with it, so you can quickly go to it and get it done. If necessary, we can always do a in-house webinar where we can talk about this, get this done. But those are some great resources that people can have. All right, we got other questions. I got another one here on this other side. You got anything else, Sister Copper, on your end?
No, sir. I do want to remind everyone to please complete our survey regarding the webinar for today.
Okay. All right. We another question going to the fall. Some people asking questions about the vaccinations for children. I guess it'd be under 12. Are they going to be available? There's a concern there about the children. Is that it was a ban out there, but it was out there in the vaccination that you know, the little kid comes home, the grandma brings on COVID. This type of thing. So are there any updates about, or you may not know the answer, but this question for kids under 12?
Yeah, so great question. I don't, and Thomas, you may have more information or have knowledge. I don't have a ton of information. I believe they're from, again, kind of just not any inside knowledge, more just what I've seen in the news, that the trials for the age 2 to 12 vaccine are underway. So we'll see when that would go through, and just like the other ones, they would go through the full, they would go through the process to receive the emergency use authorization as the other ones have.
All right, I guess I can probably step in and answer this question. People are asking that say I'm in a state that didn't expand Medicaid, and I didn't go through for the ACA. But let me throw this at Sharon. I'm gonna take a crack at this. Don't forget about the federally qualified community health centers. They're located all across the country. And Mississippi has a great network of them. We have people that talk to us. Our motto is nobody leaves us without having a place to go see a doctor. So Sharon, you can just tag team on what I said. That's all.
Yeah, that's a great promo for the fairly qualified health centers. They offer great health care on a sliding cost, on the ability of what you can pay if you're not able to otherwise get health insurance. But again, with the enhanced tax credits, I really do encourage people to go out to healthcare.gov and check it out and just see if you can still find that affordable health care, because this is the time to do it. Again, so what date? Till August 15th.
August 15th. Okay. All right. I don't think we have any questions here from our audience, but hang tight. We always do a wind down with the folks that are on the session with us. So I'm going to get you off for our social media. So for our social media people, as you all know, we always do it in two parts. We're going to wind down the social media part, and then we'll spend a few minutes afterwards. So again, we thank Sharon for joining us. We thank Thomas for joining us, and we thank Kim. And for those of you all that are on Zoom, just hang tight. Kim, Sharon, and Thomas will just have a few minutes that we can wrap up. But look, we want to thank you all for joining us. Remember, for those that are watching this at a later time, we will continue to have updates on our website. If you have things you have questions about, don't try to guess. Email us at info@hopenbc.com. We monitor it. Now, we're not going to answer the email at 3 o'clock in the morning. But typically within 24 to 48 hours, we will respond back to it and give you information. We'll be able to find and connect you with that. All right, you already know about our marketing updates, that this is coming up to make sure for our Summer of Health and Wellness VBS, for those that are going back and doing things with our young people, make sure we get some exercise with them. Remember, fireworks safety runs through July 4th, and July is National Minority Mental Health Awareness Month. Don't forget our website, hopenbc.com. When you go there, you can find the links to our Facebook page, our Twitter feed, and to our YouTube channel. Please go to our YouTube channel. And thank you all for all the positive feedback you all have been saying, that you've been using our YouTube videos as a part of your health ministry, part of things doing your church. Look, let us know. We're doing everything that we can to provide additional resources that we can in support of our YouTube page. For those that are watching, on that, we have we'll also click, we'll put a copy, Sister Copper will copy and paste it on our HOPE Facebook page so that you can have the webinar survey and give us feedback. On behalf of our team, myself, Dr. Michael O. Minor, Lottie Minor, Pastor Bernard Montgomery, Bettina Campbell, Pastor Destiny Moraney, Ellen McKnight, Dr. Felisa Washington, Minister Geraldine Moore, Dr. Desi Levy, Linda Carper, Loretta Miller, Dr. Lavora Williams, and Michelle Johnson. That's our team. Once again, we acknowledge our president, Dr. Jerry Young, who reminds us to envision the future exceptionally. This has been a production of the National Baptist Convention USA Incorporated, the nation's largest Black denomination. God bless and God keep you is our prayer.